Time and time again, we hear from Californians. One of their biggest concerns, COVID-19 vaccine distribution. From the healthcare perspective, this speed is to be expected.
We in local public health are realistic. We know what it takes to put on mass vaccination campaigns and how to deal with this.
Solano County Health Officer Dr. Bella Matias says part of the problem, some of California's politicians are creating unrealistic timelines.
The expectation is in many ways very naive.
He isn't sure if concerns addressed by health officials are being heard.
People who are pushing this effort forward at the political level have a narrative. The narrative is that they want to get vaccine out quickly. They want to be able to end this war on this virus, and it's a narrative that resonates with most people. You know, we're trying to keep it as real as we can for people, but at the same time, this is a good problem to have. The fact that people are frustrated at the pace of distribution means people want to be vaccinated.
Dr. Matias says everyone needs to understand there's only so much vaccine from Pfizer and Moderna to go around.
But you have to remember that they're supplying the entire world with vaccine. And obviously we want more, we ask for more, but it's not something that we can just go and do. It's, you know, if it's not there, it's not there.
So last week, when Governor Gavin Newsom announced people 65 and older could get vaccinated, Dr. Matias says it sent healthcare agencies scrambling. He says Newsom promised Californians something some health departments aren't able to deliver.
The governor and the state health officer both made a promise that they can't keep. There isn't enough vaccine for us to be doing 65 and over right now.
The health officer says California needs consistency. He adds the state should stick to the set of tiers it originally came up with, which identified who's most important to get vaccinated first, then work down the chain.
Politically, people are putting a lot of pressure on decision makers, and they're influencing that. And over the past month, there's been constant jumping of tiers by groups of people where sometimes it doesn't even make sense why they would jump a tier.
As the COVID-19 pandemic wears on, the Solano County Health Officer says relief is rolling out, but he asks people to still do their part.
You know, I understand we're more than a year into social distancing and the impact of this disease on our lives, and it's really, really difficult to keep doing that. But there is light at the end of the tunnel. And if we can continue to be diligent and careful for a few more months as a community, we will have emerged on the other end of that with a highly vaccinated population.
Brittany Johnson, KCRA 3 News.
And we just heard from California's Department of Health minutes ago. In a statement, it says, quote, counties are given the freedom to make decisions that reflect that county's priorities. Now, vaccine supply is limited in every county, in every state, in every country. We look forward to collaborating with Solano County to equitably and efficiently distribute vaccines. With many of the state's hospitals full, the state prioritized individuals 65 and older to help reduce the strain on the healthcare system. End of quote.